All right, everyone. Welcome back to the Zero Downside Podcast. I'm Dr. Wade McKenna, and we're brought to you, as always, by MOABTexas.com. Okay, so the question today is, how long does a stem cell last? Or how long does a stem cell injection last? The answers on the internet are all over the place, right? And the answer from an actual lifespan of the stem cell depends on which stem cell and where is it from. But it's anywhere from a couple months to a couple years. When you talk about the efficacy of a stem cell injection from bone marrow aspirate concentrate, I think that you're looking at somewhere in the knee. What's published is you continue to see cartilaginous reformation from somewhere between 3 to 4 months, maybe up to month 6. Kind of what I tell people is at about 20 weeks, kind of what you have is what you have. But it really depends on what tissue are we injecting. If you're injecting bone marrow aspirate concentrate, an autologous stem cell, meaning from you, those cells, you're going to start seeing soft tissue remodeling and healing of a partial thickness or interstitial tear somewhere 8 to 12 weeks. And once that tear is healed, those cells are still around, but they're really not, the apoptosis or cellular senescence, or that cell kind of being turned over and new cells are generated, is really right around that 16, 20, 24-week mark. So what I tell people is usually somewhere around 4 or 5 months, kind of you've had the injection, that's pretty much the lifespan of the increased ability to overcome the problem and heal if it's a musculoskeletal complaint. So when the answer is somewhere around 3 to 6 months, of soft tissue healing is what you're going to get. Most of those problems that we treat from a bone marrow aspirate concentrate perspective are kind of a one and done. There's not a lot of areas. Now, there are some exceptions to that. Chronic limb ischemia. You have a dead limb, bad diabetic neuropathy. Is it multiple injections over a longer period of time to get that effect? Yes, and that's very well published. You're going to see significant reformation and remodeling of the tissue, avoiding that hemostasis and inflammatory response for 4 to 6 weeks at a time with bone marrow. But that wound is still going to be metabolically ruling over your body's ability to fight back, so multiple injections may be needed. Interdiscal, most people see significant resolution of an annular tear at somewhere around 12 weeks. And I think pretty much those annular tears at around 6 months, kind of what you have is what you have. So I think that's a difficult question to answer in a very specific term, but not a difficult question to think about in general terms. How long does a stem cell last? How long is a stem cell injection going to make a difference? Where does it get you on the overall scale of what you're looking for? Depends on what result you're wanting. But really somewhere about 6 months, kind of what you have is what you have as far as that treatment. Most of the time that treatment has resolved the problem. And so I think that that's probably the answer, is most people are kind of one and done. And the bone marrow aspirate stem cell injection that you got can last up to a year, but any healing you get to keep. That's the other side of this, right? So when they talk about you're still seeing cartilage regeneration at a year and 3 years after injections in the knee, right? So what we say is you're going to see dramatic cartilaginous reformation and healing, and any new cartilage you get to keep. So your wear perspective is kind of like turning back the hands of time a little bit. Hopefully that answers the question. I know it's general terms, but that's the way the body works. And there's not a lot of timelines on some of this, but certainly when we inject bone marrow aspirate concentrate into someone's knee, we don't see the knee continuing to get better for 3 years. What happens, though, we've had plenty of patients come say, I'm still getting better, I'm 2 years out. Yeah, because now you have better healing of the cartilage. You're not as inflamed. You've been doing more. Your muscle mass has continued to improve. That's the whole goal of the treatment, is to make it where you get better. But the actual cellular effect on that was probably the first 4 to 6 months. Thank you for your attention. Please remember to comment, like, subscribe, hit the notification bell. And again, as always, I appreciate the attention and from our patients, and thank you.